Welcome to the Concept Map completion video. In this video, we will walk through how to complete a concept map on an example patient. A concept map is a way to organize your thoughts, find relationships between concepts, and structure your patient care. Please note the concept map shown in this video is not specific to a certain course. Course-specific requirements can be found within the concept map guidelines provided by your course faculty. You must review these guidelines to ensure understanding of what is expected of you at different semesters of the nursing program. For example, J1 expectations are different from S2 expectations. Before you complete a concept map, you must have patient information, including their history, reason for admission, course of stay, current lab values and radiology findings, current medications, as well as a thorough head-to-toe assessment. You must gather and/or have access to this information prior to beginning your concept map. Take a moment to read about our example patient. Once you have reviewed the patient information, you should begin the concept map in the center block. Reason for needing healthcare, medical diagnosis or surgical procedure, and key assessments. As you can see, our example patient came into the emergency department due to a loss of appetite, nausea and vomiting, and abdominal pain. The patient was given an admitting diagnosis of superior mesenteric artery syndrome. This is a digestive condition that happens when the duodenum is compressed between two arteries, the aorta and the superior mesenteric artery, which can cause complete blockage of the duodenum. It's important to note the patient's history, which includes depression and anxiety from losing her boyfriend in a motor vehicle accident 2 months ago. This is key to our current hospitalization because the patient ended up losing 25 pounds in about 10 weeks. This all started with the passing of her boyfriend. The key assessments portion of this block refers to the important assessment data that is required to take care of this patient. As nurses, we are going to complete a full head-to-toe assessment. However, if you are focusing on certain body systems based solely on the medical diagnosis or surgical procedure and the reason for needing health care, what systems would you focus on? In this case, we need to focus primarily on the gastrointestinal system, as the patient has an NG tube to low continuous wall suction, is on PPN, and has a digestive medical diagnosis. A secondary assessment could include pain. From here, we can move to the outer boxes, key problems or nursing diagnoses. How you complete the key problems or nursing diagnoses of the concept map is going to depend primarily upon what semester in the program you are, as well as how you process information. For J1 students, it may be helpful to start with supporting data instead of trying to find a nursing diagnosis first. Once you complete your head-to-toe assessment and patient history, you need to start grouping like data together. For instance, a loss of 25 pounds within the past 10 weeks, that correlates with the BMI of 15.3, which correlates with an albumin level of 3.5. These are all related to nutrition. Alternatively, admitting to only eating occasionally, losing 25 pounds in 10 weeks, and stating an inability to cope with her boyfriend's death. These are all related to a psychosocial nursing diagnosis. Notice that you can have overlapping data that corresponds with different nursing diagnoses. Finally, we have a verbalization of pressure in the nasal cavity related to the NG tube, as well as a pain rating of 6 on a numerical scale of 0 to 10, which corresponds to a pain diagnosis. Once you have your supporting data grouped together, it may be easier to find a nursing diagnosis that matches. From this point, you can look at nursing diagnoses related to nutrition, psychosocial, and pain. For J2 students and above, or for students who prefer to start with the nursing diagnosis instead of the data, you need to identify NANDA-approved nursing diagnoses that correspond with your patient and the information you have available. For this section, you can use your nursing diagnosis handbook. Your level determines the minimum requirements for nursing diagnoses. Please review the concept map guidelines to determine the minimum number of nursing diagnoses you must include. Each nursing diagnosis must include appropriate related data to include assessment, lab and radiology findings, vital signs, and medications. Note that not every nursing diagnosis will include all of this information. It does not matter which of the outer boxes you start with, and at this point they do not have to be prioritized. The following nursing diagnoses should be created for this example patient. Acute pain related to tissue trauma secondary to NG tube placement, as evidenced by, which is our supporting data, a patient verbalization of pressure in her nasal cavity, rating the pain a 6 out of 10 on the numeric pain scale. Imbalanced nutrition, less than body requirements related to inability to digest foods adequately, secondary to SMAS, and decreased oral intake secondary to NPO status, as evidenced by a loss of 25 pounds within the past 10 weeks, BMI of 15.3, and an albumin level of 3.5. Ineffective coping related to situational crisis, the unexpected death of her boyfriend, and destructive behavior towards self, as evidenced by only occasionally eating, losing 25 pounds in 10 weeks, and stating an inability to cope with the boyfriend's death. Risk for impaired skin integrity related to poor nutrition. Once you identify appropriate, relevant nursing diagnoses for your patient, you must prioritize them. The example diagnoses are prioritized as follows: imbalanced nutrition, acute pain, ineffective coping, and risk for impaired skin integrity. You should write the prioritization number in the blank in front of key problem/nursing diagnosis. For J1 students, after you prioritize your diagnoses, you must draw lines from the center box to each outer box that you utilized. These lines should include a brief explanation of the relationship between your admitting diagnosis and key assessments and each nursing diagnosis. For J2 students and above, after you prioritize your nursing diagnoses, you must create relationship lines between nursing diagnoses and include a written explanation of how they are related. Looking at the example, there are relationship lines between imbalanced nutrition and ineffective coping. The reason these are related is because this particular patient stopped eating appropriately when her boyfriend passed away in a car accident. These two diagnoses are related to one another. A second relationship line is created between imbalanced nutrition and risk for impaired skin integrity. Due to the patient's weight loss, current weight, and albumin levels, the patient is at increased risk for skin breakdown and pressure ulcers. For this portion, you simply draw a line between the related diagnoses and write a brief explanation of the nature of the relationship. All relationship lines should include pathophysiology as appropriate and as it relates to the diagnoses you have identified. From here, all students move to the second page of the concept map. You will create one of these tables for every nursing diagnosis that you have identified. If you have 3 nursing diagnoses, then you should have 3 copies of this table, 1 for each diagnosis. For this example, we will only complete this table for 1 nursing diagnosis. On the second page, you should start with the problem and nursing diagnosis in the top box. Write the nursing diagnosis that you are creating a plan for. These should be in the order in which you prioritize the diagnoses. For this example, we are looking at imbalanced nutrition, less than body requirements, related to inability to digest foods adequately, secondary to SMAS, and decreased oral intake, secondary to NPO status, as evidenced by a loss of 25 pounds within the past 10 weeks, a BMI of 15.3, and an albumin level of 3.5. Here, you simply restate your entire nursing diagnosis. The second portion of this top box is the general goal. This does not have to be specific or measurable. Simply write a generalized goal for the patient, ideally the opposite of your nursing diagnosis. Our concern with this example patient is that she has lost a significant amount of weight. Our general goal is that she has no additional weight loss and/or that she gains weight during the hospitalization. The second box is the behavioral outcome objectives. This is where you will write a SMART outcome. SMART stands for specific, measurable, attainable, realistic, and timely. You should start your outcome as patient will. The behavioral outcome for this patient is patient will have no additional weight loss by discharge. You can have more than one outcome in this section. This outcome is specific, no additional weight loss, measurable, we can monitor her weight, attainable, the patient is on PPN, she should ideally not lose any additional weight, realistic, this is an outcome that she can achieve with the current medical interventions in place, and timely, our outcome is by discharge. The next box, nursing interventions and strategies with rationales, should identify several realistic, specific interventions that you, as the nursing student, can do to help the patient reach the identified outcome. 2 interventions have been included in this example. However, you should not limit yourself to 2 interventions if more apply. All appropriate and applicable interventions should be initiated. For this section, you may reference your nursing diagnosis handbook. However, bear in mind that the interventions in your textbook are generalizations and may not be appropriate for every patient. You should identify interventions that are specific to your patient. If you use interventions from the textbook, you may need to reword them in order to fit your patient. These are not a one-size-fits-all. You should also prioritize your nursing interventions based on importance. The example nursing interventions with rationales include the following. Weigh the patient every morning while in the acute care facility with the same amount of clothing and at the same time every day. The rationale is to obtain weight to determine further weight loss or needed weight gain, and also determine BMI. Our second intervention is to consult with a registered dietitian concerning the PPN, as well as a possible need for IV lipids. Rationale is to determine the exact nutritional content needed by the patient and to solve any present nutritional problems. The next box, Patient Response to Interventions and Strategies, contains your patient's specific responses to what you have done, to your nursing interventions. You must be specific with your patient responses. If your interventions include assessing vital signs, then include the vital signs that you assessed and what those numbers were. If your interventions include assessing pain levels, then your patient response should include their pain rating and how often you assessed it. If your interventions include education, then your patient response should include what exactly you taught them, how you measured their understanding, and if they need further education. The example patient responses include the following. The patient was weighed this morning. Her current weight is 94.64 pounds. Current height is 5'6". We spoke to the dietitian regarding the potential need for lipid emulsion due to the patient being on PPN. The dietitian agreed and added intralipid 20%, 500 milliliters, at a rate of 1.2 milligrams per kilogram per minute once a day. Finally, the last box is your evaluation. This is a summary of your patient's progress toward the behavioral outcome objective. This evaluation should be started as the outcome was met, partially met, or not met, followed by a rationale of why the outcome is either met, partially met, or not met. Our example evaluation is as follows. Outcome partially met. The patient's current weight is 94.64 pounds. The patient's weight at time of admission was 94.5 pounds. We will continue to monitor daily weights on the patient until the time of discharge. We will continue to assess for any weight changes, as well as report any changes to the registered dietitian and attending physician. The example outcome was partially met because our time frame was by discharge. At this point, we cannot say the outcome was met because we have not yet reached discharge. If your outcome is not met, you must provide a written explanation proposing a change in the plan of care so that the patient can meet the outcome. Remember, you must have one copy of the second page for every nursing diagnosis that you identify. In the example provided, that would mean there would be 4 copies of the second page, one for imbalanced nutrition, one for acute pain, one for ineffective coping, and one for risk for impaired skin integrity. Finally, if you utilize your nursing diagnosis handbook or any other resource, you must include a reference page and in-text citations. These should be written in APA format. Now we have walked through the process of completing a concept map. Keep in mind that you should review the guidelines provided by your faculty and all relevant patient information before starting your concept map. Resources like the Nursing Diagnosis Handbook and Concept Mapping textbook are useful. Thank you.